So my name is Victoria. I am the co-founder and CEO of Pace AI. And what we're building is AI that helps bridge the gap between English language learning and professional development, and especially in technical last mile English training for pathway programs like healthcare. And so I want to share a little bit about our background and who we are. So Pace AI is a native AI ESL platform. We were incubated at the Paul Allen Institute for AI Research up in Seattle. And we started out because of myself and my teammates' backgrounds in working with adult learners who were learning English for vocational purposes. We started out partnering with immigrant retraining programs and upskilling centers, industrial affiliates programs, and universities. And more recently, we've been partnering with community colleges, continuing education colleges, school districts focused on adult learners, as well as immigrant education programs. We have global learners in over 95 countries, and our entire team is comprised of TEFL-certified educators. So we are experienced in teaching English to adults in particular, and we're also AI researchers and engineers. And so a little bit about my background. So I was previously in a PhD program at MIT. I actually left the program to build Pace AI. And prior to that, I spent time as a research fellow in applied AI and ML at Microsoft Research. And prior to that, I was also a TEFL-certified English teacher when I worked with adults in different career upskilling contexts. Going to be admitting a few new folks in from the waiting room. And folks, as you join, please, to give me a little bit of context, it'd be great if you can drop in the chat your name and your role and which institution you're coming to us from. And because it's a small group, I'd like to keep this really interactive. If you guys have any questions, please feel free to jump in. Otherwise, I'd love to share with you some of the use cases that we've done with our partners and the features on our platform that allow teachers and programs to bridge that gap between English language education and workforce training. So our platform is taking any content and transforming that's training content for the healthcare context in particular into interactive lessons that are tailored to different student levels. And so the kinds of healthcare career pathways courses that we're working on with our partners include certified nursing assistants, medical assistants, licensed practical nursing, EMT, EMS, and other kinds of programs. And great to meet you, Yaneth from Fresno City College. Thank you for joining us. And so what does it mean for our AI to work with any custom content? So this means that you can upload any training content. So that can be, so this is an example here is in this little video, you can upload a PDF or a Word document, a website link, or it could be custom text that maybe you've created in conjunction with a subject matter expert. And you can upload that content, and the training materials, that could be something from an employer sponsor, it could be pages of a textbook, it could be really anything. So this is an example from a handbook, and this is for emergency medical services. And as you can see, once you've uploaded that piece of content, the AI will actually take that in, read that, parse that, and transform it into an interactive learning experience. So here what you'll see is a student would be able to click on each individual word or sentence in that content and get word lookup. So this is, in this view, this is English language learner's dictionary definitions from Merriam-Webster. So for the word care, these are some learner's definitions. Additionally, because we work a lot with a very diverse adult learners, we also support native language translation, so you can get the lookup of these words in your native language. We currently, in the Learn modal, we support that translation to Spanish, Mandarin Chinese, and Japanese, given some of the learner populations we've worked with recently. But there's also and I'll show this later, the AI tutor, who is able to help assist students beyond those native languages. And the AI tutor will be able to support with translations in context for languages, over 100 languages. So as you'll see, you'll be able to click on that word, get the definition lookups. You'll be able to hit play, so you could, as a student, practice hearing those sounds pronounced out loud. You'll also be able to record yourself, and I'll show you what that looks like when we look at our full feature set of skills-based language training on the platform. So once that content has been brought on and ingested by our artificial intelligence, what happens is it transforms this training content into personalized exercises that meet students where they are by being both level appropriate and interactive and providing real-time feedback. And so these are some of the examples of the kinds of exercises that you might see as a student. So you might get vocabulary exercises, you might get collocation exercises in learning the language around different types of vocabulary. So in this case, you're being asked to pull out the adverb and adjective collocation. In this example, we're looking at a conjugation exercise. So you have these different words in context. How do you conjugate them? And then in here, you see an example of pronunciation in context. So given a specific word, can you say that in context and be understandable? And so the idea here is students are developing English language skills in the context that matters for them. And so we're showcasing a couple different use cases here, but this example is from a kind of medical training context. So some instructions for how to prevent the spread of disease and to be safe and healthy. And so these are some of the different types of exercises. Hello, Tamberly. Thank you for joining us. And this is a small group, so I'll just say, if you can type in the chat your name, your affiliation, and your role, that would be really helpful for context. And because it's such a small group, I would love to keep this as interactive. So if you'd like to ask any questions or if anything comes up, please feel free to jump right in. Awesome. So with these personalized exercises, it's meant to help students with the skills-based competency for language acquisition in their medical or healthcare profession. Additionally, in terms of that interactive learning experience, we have a built-in audio reader that gives students that ability to transform this content into a listening practice experience. And this is really useful, especially, I'm going to go back a little bit, but this is really useful, especially for students who might have sporadic attendance. We work a lot with partners who have open enrollment models where students might be joining late. They might be here in week 2, gone in week 3, and back in week 4. And we want these students to still be able to stay engaged at their own pace outside of the classroom context as needed. And so in those cases, these students really benefit from having these asynchronous learning tools that allow them to continue to plug into the content and get both the personalized lessons built for them to engage with the material, as well as this interactive listening and speaking training. So they can listen to that word and they can hear that word pronounced out loud. They can toggle the speed. They can also record themselves and get feedback on how they sounded. And this is real-time AI feedback. And we actually use a neural acoustic model to do this AI-based pronunciation training. And what that means is this neural acoustic model, it's trained on hundreds of different kinds of accented English speech patterns. And so this means that even students with an accent, they can score 99, 100% on these pronunciation tasks because the AI is predicting whether they can be understood in context rather than accent reduction. And so this will show you a little bit later on some of the learning outcomes, but the key here is this has allowed students to gain a lot more confidence, to know that I can be understood even if I have an accent. And that's been really important. And so AI is able to help us with that kind of grading. So I know a few other folks have joined us, and I just want to repeat, if you're joining us now, please write in the chat your name and your affiliation and your role so that we have some context for this conversation. And additionally, it's a pretty, intimate group. So please, if you have any questions or want to chime in with thoughts, please feel free to do so during this presentation. Thank you all for joining us. Okay, so moving on. So learning vocabulary in context and what that means. So I touched on this a little bit when I showed how the learning experience can be interactive, but the idea here is from this training manual. So this is from a handbook from the Red Cross. What students can do is actually click on any word or sentence. In this case, intubations is clicked on, and you can see the base form of the word, as well as be able to look up the learner's definitions or your native language translation. You'll also be able to hear that word read out loud by pressing the play button, as well as record yourself and get real-time AI pronunciation feedback. So this is one of the very popular use cases with our partners who have learners that are really diverse and have different English language proficiencies, so that they can, some learners might want to be focused on the really advanced vocabulary in this handbook, while other learners might need more support in the basic vocabulary in addition. And so this is a way that students can plug in, interact with the content, and get the practice and feedback that they need. So the next feature I want to show you is our AI tutor that is providing on-demand support 24/7, because AI never has to sleep, for every single learner. So every single student will be equipped with their own personal AI tutor, and this tutor will give them support outside of class hours. And so the tutor is able to tailor its language. And so this is why it's a personal AI tutor. The tutor tailors its language to the student's level and can also communicate with the student in their native language as needed. And so this is really useful for, again, the very diverse adult learner populations we work with, who also have different native languages and also English learning proficiencies, to have this AI tutor who supports them at a level that's Lexile appropriate. So of course, in a lot of core ESL programs, you might want to encourage monolingual learning contexts. So you might want to encourage students to only get responses and Q&A in English. But for sure, in the career training program settings, a lot of times you need to build in more of those scaffolds. And it's really challenging for a teacher who does not know all of the native languages represented in his or her classroom. And so the AI tutor is a way to plug into that. So the AI tutor can support with grammar, and also in their native language, in this case in Spanish. And it can also provide support with vocabulary and different kinds of explanations as well. The AI tutor's main purpose is to have learners feel supported outside of the classroom, regardless of their learning level or their background. And so this is how the platform's AI is meant to meet learners where they are, both in scaffolding the lessons, the exercises that are being generated from the healthcare pathways contexts, and also in scaffolding its responses and tailoring that in a way that's Lexile level appropriate, or of course, in their native language. So I want to spend a little bit of time talking about how classroom integration works on our platform. So we're not meant to be a learning management system. And so what that means is the teacher side is a very lightweight, easy to use, easy to get onboarded onto platform. And it's a dashboard that allows teachers to have full control over their classroom management. So they can create classes in one click, they can invite students in one click, and they can create assignments in one click. So for inviting students, we have many different options for students to get onboarded onto the platform. We do this because a lot of the learners we've worked with come from diverse digital literacy backgrounds as well. And this is a way, for example, for teachers to manually create accounts for the students so that they can log in and not have to deal with forgotten passwords and logging into emails and so on. Of course, for students who have their Gmail set up and for classrooms who are already using things like Google Classroom or Workspaces, we also support single sign-on with Google. And that means really seamless one-click onboarding for students to log in. Additionally, we do, while we are not in LTI right now, we do support assignment link embedding in all of the popular LMSs out there. So if you use Canvas, Schoology, Blackboard, so on, you will be able to actually paste in our assignment link into, for example, a Canvas page to embed that. And then when students click on that, they will be brought to our platform because that's where our AI models and everything is hosted. The experience is student-centered after all. But once students are clicking on that link, they'll log in or they'll create their account and they'll be brought directly into your assignment for the healthcare course. I'm happy to answer any questions on this at the end as well in terms of what integration looks like. But I also wanted to show you what the progress tracking looks like in the context of English language training for healthcare. So in the case of students who are learning in that career and integrated education context, what we're looking at is, are they able to build and strengthen the vocabulary, especially through acquisition and context? And so a huge part of our focus is seeing that learning in the context of what matters to them in terms of the healthcare training materials is actually allowing them to retain the vocabulary for longer. And two other key learning outcomes that we've seen with our partners is an increased confidence in communicating, especially because the pronunciation training is judgment-free and it's training on comprehensibility and understandability as opposed to accent reduction. So we've seen a lot of students who already they know the vocabulary, they have the grammar, they just are shy about producing orally and they're shy about communicating. And so we've seen a lot of improvements and gains in that student population in feeling more confident about speaking, especially in the workplace context that they need this for. And of course, another key learning outcome for us is strengthened digital literacy and a reported ease of navigating new technologies, either in our platform or beyond, as exhibited by self-reports and what their teachers are documenting. And so what you're seeing here is an example of a teacher dashboard of the kinds of exercises that students are completing from an assignment. And you'll get to see the scores of the students, the kinds of words that they're learning. And for any pronunciation exercises, you'll also be able to play back how they sound in those exercises. So the key takeaways and the three pillars of our platform. So our platform is harnessing AI to build English lessons that are personalized, level appropriate, and context relevant directly into your healthcare pathways programs, content, or courses. And so how we do this is each is represented in this slide with the three pillars. So the first is we empower teachers, English language teachers, to work with subject matter experts or independently and empower them to teach English on any technical topic using any materials that they might have. So this might be their own materials, that they've curated in their collection. It might be materials that they have from an employer sponsor. It might be materials that they have from a textbook or manual, or all of the above, or any combination of the above. And we also have a library of authentic content that can be used to supplement the language training involved in the healthcare pathways courses. Now, once the material is decided upon, teachers will be able to one-click assign that content as an assignment to their class. And then our AI will then create these personalized English lessons that are skills-based, they're context relevant, and they're adjusted to different student levels and the pain points of each individual student. And that is the student-centered portion of the platform. And then as a direct consequence of that, students will be able to improve with real-time feedback. And so, especially with diverse student populations who have several different native languages represented and also come in at different proficiency levels in English, the tailored, personalized, real-time feedback that they're getting alongside these exercises empowers them to learn autonomously, and also empowers them to get support outside of class hours, outside of the class context. It also means that inside of a class with multi-level learners represented, you can address and serve the needs of each learner without overburdening the teacher and asking them to create 30 or 40 different kinds of lesson plans and exercises for each student. So I have done a lot of talking at this point, and I really wanted to keep this presentation intentionally short so that we have a lot of time to open up the floor. And I'd love to hear from all of you and get your questions answered, and also hear about the kinds of pain points and challenges and needs of your learners in healthcare pathway programs. So I'm going to take a pause, and also feel free to unmute and ask any questions or anything that's top of mind for you that you'd like to talk about as a group. You can also type any questions or thoughts into the chat. Maybe I can kick us off with, or Milena, I see you have your camera on. Do you have a question? Okay, never mind. No worries. I see Diane has asked, any idea of what the software/site license costs? Yes, so in terms of pricing, we have a seats-based model for active seats per month. So our license cost is $10 per active seat per month. And that would be all under an institutional license. And teacher accounts are 100% free. So the $10 price is for the student accounts. And we are very familiar with working with open enrollment models. So in terms of students who come and go, we actually manage that on the back end in terms of what's determined as an active seat. So you're really paying for that active seats per month.
Okay, I have a follow-up question. Thank you. So it's $10 per active seat per month, but what is the site license cost for the institution?
Yep, great question. So our platform is built to scale, and we pass those cost savings back to our institutional partners. So it'll depend on the size of the program and the scale of the rollout. So that's something we just work with our partners with on an individual basis. But we do also have discounts for program or district or site-wide adoption.
Okay, can you give me any idea, like for 100 students, or whatever your breakdown is per scale? Any idea?
Yeah,
because that cost is going to be higher than the $10 per seat.
Great question. So the $10, it'll be roughly, it's going to be $10 per seat per month for intervention size rollouts. So roughly up to 100, 150, but it depends a little bit on your use case.
Okay, so that's the per seat cost. But you also mentioned there's a cost to the institution for the site license. That's what I want to know.
Got it. No, there is no separate cost for the site license.
Oh, okay. I misunderstood. Sorry. Thank you.
No, great question. Thanks for clarifying. Yes,
Okay.
yes, I was confusing there. Yeah, so you'll purchase a site license that contains these seats, and you're just
I
paying.
see.
Exactly.
Yes, it's per student thing. The cost is per student. Okay.
It's per student per month.
Yeah.
Yeah.
Okay. This is interesting. Does your platform have any other this is for healthcare. Does your platform deal with anything else or any other kinds of CTE education, perhaps?
Yes, so we actually handle all of the, kind of a lot of different technical topics. We also handle core foundational ESL as well. So a lot of this presentation is really focused on some of those use cases that we've seen with our partners in healthcare. But we've also, outside of this sphere, have worked with other kinds of technical training. So in manufacturing, for example, IT, software, things like that.
Okay.
Do you have specific
Well,
verticals, spaces in mind?
yeah, well, we have, many certificate programs for CTE. And I think this sounds like it would be a good solution for the different proficiency levels that the students come in at. Um, so we have things like automotive training, respiratory technician, other things in the healthcare, plus other areas like automotive. And I think if so, would you have to sign up for a site license per area, or could you? Yeah, I think it would be that way. Like you'd have to get the program for healthcare, and then if you wanted something for a different subject area, that would be a separate platform. Am I correct?
Great question. So actually, all of it is in the same platform. So you
Oh,
can actually use our same platform. So the way our platform works is our AI will work with any piece of content that's that text-based
okay.
text. So you
Oh,
can then use that for, you can use it. We've seen this used for like airplane mechanics context, different kinds of technical operations, healthcare certainly. And so you can really use this. The beauty of the AI is it's very flexible in working with different types of technical content and then parsing that into language and then scaffolding the lessons around the language. So I will say our purpose is to teach to the language, the linguistic aspects of the technical training, rather than, the actual hands-on technical training.
Okay, I understand, which is what the students, the second language students, that's what they need when they sign up for those classes that are taught in the native language, in English, really. Okay.
That's exactly right.
Okay, and this sounds really good. If I wanted more information, could I just email you?
Yes, let me actually drop for everyone my email in the chat.
Okay, thank
You
you.
want to take that down?
Okay, thank you. I see it.
Wonderful. Yeah, and of course, anyone here you're welcome to reach out to me if you have any other questions or want to chat about specific use cases in your school or program. If you feel if it hasn't been covered, for example, in this breakout or any of the other sessions.
I think it would be particularly helpful in our ESL lab.
Yeah.
Because those students, we don't actually know sometimes, what subject they're interested in. Even if they're taking an ESL class, they might not be in the discipline or subject area yet. So I think it would be excellent if we could have a program like this in the lab where you could call up the discipline that you wanted or the subject area.
Yeah, certainly. We've also been used in labs in the past as well with some of our partners where it's in like a computer lab setting and you can upload the content and so on the teacher side, you'll actually be able to create classes and each of these classes can be based on the topical areas. So Diane, in your case, you might have one class that's focused on mechanics and one on something in healthcare, something else in IT or something or so on. And each of those different fields could be their own class in terms of the content. And then students can, in a computer lab or something like that, log in to their own account and then see, okay, I'm going to be registered in this mechanics course, or I'm going to be in this nursing course, and see the content for that leveled to my level.
Okay, thank you very much.
Wonderful. Great questions. Thank you, Diane. Anyone else have any questions or use cases that they're thinking about bringing AI into in their programs that you want to discuss with everyone?
Actually, I have one last question.
Sure.
Is it possible you can send me a link so that we can do a demo? Like I can give it to the ESL lab coordinator and we can try it out?
Sure. So we do have you would be able to create a teacher account on our platform.
Okay.
I can send you, but you won't be able to let me get
Basically, what I'm asking for is, a demo. Can we try it out?
Sure. Let me.
Okay.
So you would be able to sign up. I sent the link in the chat. That's how you would sign up as a teacher.
Okay.
Teachers
Okay.
can sign up for free outside of an institution. And then let's actually send you, I have a video demo of what the student side looks like that I've put into the
Okay.
chat as well.
Okay.
So because we also sell our student accounts directly to learners across the world, those you can sign up for a free trial for, but
Okay.
would be that would be the primary way. Or we can also we can connect offline from this conversation, and we can set up a time for me to show you
Okay.
and I can give you some student demo logins to try out. So if you'd like to try that out on the student side, apart from signing up as a teacher, anyone who's interested in that, please send me an email and we can set up time and I can give you some student logins to try out for yourself. Does that work? Does that sound good, Diane?
Okay.
So by a show of hands or in the chat, how many folks in here are working with multi-level classes in these healthcare career pathways courses?
Okay. Yeah. Okay, thank you so much.
Is anyone working with multi-level classes in ESL programs right now?
Well, the classes, we have levels, but the problem is under California law, we no longer are required to give students assessment, so they can self-place. So what's happening is that classes are filled with students at different proficiency levels.
Totally get
And
it. Yeah.
yeah, and so usually sometimes if it's a writing class, you can give a sample and you can kind of advise a student if they need to take a higher level or lower level. But you can't actually say to the student, okay, you should not, you need to go and take another class. I mean, you can suggest that to them. It's much easier to tell them or to suggest to them to take a higher level class than to say to them they need a lower level class. They don't really take too well to that. So the reality is the classes are filled with multi-level students.
That makes a lot of sense. And what are the current approaches that you are using in your program?
Well, I myself, if I'm teaching a writing course, I give a writing sample on the first day. And usually I can tell from that if they're greatly, underplaced or overplaced. And just last week, I had a student come into an intermediate listening class, and she could not answer, "What is your name?" She asked me for Spanish translation, and I knew immediately she couldn't understand anything. So we don't have a lower level class than that. So I got somebody, I don't speak Spanish. So I got somebody in the class to explain to her that she needed to go to the adult school because they deal with that low level and they provide, I believe, translation at that very low level. So, we don't have what shall I say, policy right now, but you just have to do the best you can in the first week or two to try to assess where the students are and then give them some advice that might help them perform better in a different level class.
Right. That makes a lot of sense. I think that's definitely something that we see a lot in the field as well, where you have students who are self-placing or who don't even know what their level is coming in. And they're all kind of placed into that same class. And hence you have this variance of levels being represented. And at the end of the day, they're all here to pass a technical exam or a medical exam, get a certification. And you can't, you have to scaffold not just, the content, but how do you get the exercises and the lessons to meet the students where they are. And so a lot of what our AI is doing is meeting the student where they are by scaffolding the lesson side, so that even if they're kind of misplaced and they've over or underestimated their level, they're getting something that's tailored based on the AI who's learning their strengths and their weaknesses. So I'm going to stop sharing the presentation. If there's any other questions related to it, I can always go back, but please let me know if you have any other questions. Otherwise, I can show you. I know we have just about 15 minutes left. I would love to show you a little bit of what this platform looks like live. So Diane, this can be a kind of a demo as well on the screen.
Yes, thank you very much. Thank you.
All right, so I'm in a test account here, and one thing I want to call out right off the bat is the AI tutor. So you mentioned Diane, a student who did not know what is your name and did not know what that meant. And so the AI tutor for a student in that class can also help with translations of content in their native language.
Okay.
So this is, we're asking about, what are psychomotor skills? You can get some further explanations here, and you can also get it in Spanish. So this is basically, you can think of this as ChatGPT, but it's for the language learner. So, typically we think about ChatGPT, we always joke with educators, it's kind of called Chatty GPT because it says a lot and it's not really friendly for language learners, because the underlying model of large language models, the data is Wikipedia, it's New York Times articles, it's online public fora, it's all of this content that's made for native speakers by native speakers and not with an eye towards language learners. And so the idea of this is to tailor that to the language learner context, to their Lexile level, and also to their native language as needed. And for the interactive, so you can click on any words here, you can get the learner's dictionary. But for the purpose of this, I'll actually show you what this would look like if I had set my translation language to Spanish, for example. And now I can click on the words and I get some synonyms, and I also get the Spanish translation.
Really good.
I'm sorry? Oh, Diane, did you have a question? Sorry, I think you're muted now.
No, I just said that is very easy to use, very transparent. They see it immediately. They don't have to leave the screen. That's good.
Yes. Yes, and you can also, they can hear it.
Knowledge.
And they can also practice pronouncing it. So for example,
Uh-huh.
I'll show you here. Knowledge. And I can now hear
Knowledge.
how I sound, how the example speaker, and so on. And I can also, so this is right for this very specific context here. And then I can also do different kinds of lessons and so on. These are different kinds of skills-based exercises based on that. I can also look at different kinds of vocabulary that I might be missing and drill into those. But the core experience is the exercises that are skills-based. And I know this is for a healthcare context, but this also works just as well for authentic news content or any other kinds of, this is bus and train fares, for example. Any kind of content the AI would be able to take in. You'd get, if you clicked on a full sentence, you actually get the Spanish translation here.
Okay.
And for every word, you also get the translations.
I have a question. So you on this platform, you can call up any content by putting in a URL. Is that how you do it?
You can put in, so there's a couple options. You can put in a URL. So this would be in the public domain. So, this wouldn't be like a Google Drive doc, but this would be a link to an open education resource or a link to something that's discoverable in the public domain.
Okay.
And then this would be your own PDF or Word doc.
Okay.
And
okay,
so,
very good.
Yes, and then you can also put in your own custom text. And we have an entire editor. You can add images as well or tables to your custom text. So there's a lot of customizability here if you want to add your own content as well.
Okay.
So this is tables. You can add, images, insert an image, or it could just be, I'm just going to reload it. It could just be, this is an example, and it could just be sentences with medical terminology, for example.
Okay. Can you upload PDF files?
Exactly. You can do that. Yes.
Drag and drop or upload. Okay, thank you.
Yes, exactly.
Okay, I just thought of a follow-up question. I'm very interested in this.
Yes.
So as an example, say for instance, there are 20 students in the lab and they sign up for, let's say, a healthcare course on this platform. So the institution would get billed per month for the number of students that are using that program for the month. Is that correct?
So what we do is under the institutional license, there'll be a contract length. And so this avoids, having to create a purchase order every month. So typically that would be anywhere from 4 months, 6 months to a year, depending on the length of the program.
Okay, so you sign up for 4 months at a time. Is that how it works?
It depends on it depends on the contract length. But that could be, for example, for a 1 semester rollout.
Okay, so what if, you start with 20 students, but in the second or third month, you have 10 students. Will you still get billed for the 40 students?
If you, for example, signed up for 40 students in the contract. Yes, so you are paying for the 40 students.
Okay, whether they attend or not.
Yes, exactly.
Okay.
Now, we are a little bit lenient in terms of, with open enrollment model, if you're a couple seats over, like that's definitely okay. For us, it's, when you are much more over that, then you will basically pay for the next tier up.
Okay, okay, I understand. Thank you.
Yes, great questions.
Okay, well, thank you very much, Victoria.
Thank you very much, Diane. Anyone else
Okay.
have any questions or use cases they would like to see? I'm just going to go back to, for example, this handbook. I can show you, for example, with equipment, and you can record yourself. Equip. Okay, so I did half of it. And then if you have, for example, we were in, maybe I was in, the best bus and train fares. I have some short sentences here. I can show you just quickly is, you can hear it read out loud.
Cash payments are not available on buses.
You can also speak that. So cash payments are avail on buses, something like that. So I omitted this word, I struggled with this word, and I got these ones correct. And so you'll see the AI will give real-time feedback based on whether I was comprehensible or not. And similarly, right, I can upload any of my own content for custom text, for example, medical terminology. Maybe you want to have an exercise that's just getting your students to practice medical language. So, maybe you have words like virus, you have infection, you have sanitation, and let's say, preventive medicine, something like that. I can, as a teacher, I would be able to create something like this, and then I would be able to assign it to a class. And so for now, how that would look on, this is of course a demo account, so it's a little bit, the flow is a little different, but this is what it would look like for a student. So this content is too short to generate lessons because I only have a few words here. But as a student, if I saw this as an assignment, I would get to click into, this would be, for example, medical terminology to practice. I would see the Spanish translation into my native language. I would see the ability to hear that and also pronounce that. Infection. And get a score based on the AI feedback. And I'd also get to hear this read out loud.
Medical terminology. Virus. Infection. Sanitation. Preventive medicine. Medical terminology.
And so again, the great thing about this is from any content. So I could have written up, if I had, as a teacher, maybe I have a scenario, a role play scenario, maybe I have snippets from a textbook or other open ed resources. You can plug that right in and the AI will work with it to create this interactive experience for the student. And of course, for longer content, this also means there's lessons associated. So I'll just pick some content here. And you'll see there's tooltips with my native language there. You'll get different pronunciation exercises. I'm going to skip that for now. And you get conjugation exercises. All, in this case, this is a random article I just pulled on astronauts, but you can build, this would be built directly from if you had, for example, any healthcare, or Diane, you mentioned other kinds of certificate programs, any of that content, the AI would take and build these kinds of different exercises on. And you get, you'd get a tooltip for help, And if I'm learning right now, my native language is set to Spanish, I can also get help in Spanish. And also get to see some conjugations and so on. Does anyone have any questions on this demo, anything from the presentation? And for those of you joining us a little late here, I just want to make sure you have my contact in the chat. There's my email there. Write it in here again. And of course, afterwards, I will circulate the slides for the presentation as well, if you have any other questions or want to peruse that. Any other questions on use cases or different types of features? I think I saw a couple new names here, so I'm just going to show you, for those of you who just joined, the key flow in our platform. So you're able to upload any content. That can be a PDF from a training manual. It can be a Word doc. It can be a website link, or it could be custom text. Like I showed a little bit earlier, you could make a pronunciation exercise, and students will be able to interact with this because the AI will make it into an interactive learning experience. You would also, for example, this is a PDF from a handbook page. Students will be able to click on any word and get translations in their native language or in the English Learner's Dictionary. They'd also be able to record themselves and hear the correct pronunciation.
Immediate.
Immediate. And they'd be able to do these different kinds of exercises that are focused on conjugation, on listening and transcription. So this is making sure that they can understand when something is said to them in the context of their workplace. So this would be in the context of being an EMT, are you able to understand what's being said?
Paramedics are responsible for and accountable to medical direction, the public, and their peers.
We also have tooltips that scaffold that. So in this case, you can translate the tooltip. You can also see that, okay, this is saying I can hear just the word in isolation.
Responsible.
And I'd be able to complete these exercises. And so on. And there's other kind of reading and vocabulary exercises as well as the pronunciation. Wonderful. I know we have just about a minute left. If you all have any other questions, please feel free to reach out over email or email our support on the website. The website link is also there. Diane, good question. Where will you upload the slides? I believe I will be sending them to info@coaches or to Susie. I see Susie's on the is here as well. So I think I will send it to the organizers and I believe they will circulate them. Okay, wonderful. Does anyone have any last minute questions? And hello there, Ekaterina. Ekaterina, just for you, I have my email in the chat if you'd like to reach out. Let me And I'll also be circulating the slides through the organizers. Wonderful. Okay, and thank you, Diane, for the questions there. And thank you everyone for attending the session.